Welcome everybody to our second monthly message. I'm Anna Sullivan, Chief Medical Officer for Leahy Health Behavioral Services.
Hi there, I'm Kevin Norton, CEO for Leahy Health Behavioral Services. The first thing we want to do is acknowledge all of our staff that came in and worked during our recent snowstorms. For us, this is a real reflection of our staff's commitment to the population that we serve and to the work that we do. Afterwards, we had asked our program directors to send us a list of all the staff they thought went above and beyond. We got over 214 names submitted for recognition. So congratulations and thank you to all of our staff that continue to show up to do some great work during some really horrible weather. The first thing we want to talk about today is colleague engagement. So for the second year in a row, we did our colleague engagement survey, and this year we had 45% of our staff participate, up 5 points from last year, so we got more staff to participate, and next year we're hoping that we get all of our staff to participate. We need to hear from all of our staff to make sure that we fully understand our staff's experience of us as an employer and to figure out what are the action steps that we need to take to make this a better place to work. So for all the staff that have taken it in the past, thank you, and encouragement to all of our staff to take it in the future so that we can become a better employer. The highlight from the employee engagement survey was our readiness for change score. On a scale of 0 to 100, we had received an 87, which means that our employees are ready for change. It also shows that we have the highest readiness for change score in the system. So since we're slightly competitive, that was good news for us and for our division.
It's really exciting. It's probably the most important measure on the colleague engagement scale, and it means that our colleagues within our division are enthusiastic and passionate about the work that we do. So thanks to everybody for your participation in the survey, for our continued growth in the numbers of people who participate so we can be the best that we can be. We also want to talk about a couple of projects ongoing right now that are very exciting. The first of which is an open access project, which is taking place first in Beverly and in Lawrence. And it means that our clients can come anytime they want to have an intake evaluation. So it's not the old, calling up and finding out there's a 3 or 4 week wait when you're very, very worried about a family member. Instead, the answer on the other end of the phone is going to be, come on in this afternoon. We have retooled. The ambulatory staff has been working tirelessly to figure out how to make this work, and it's not easy. As we see how we do and how we can tweak our system to make it work best for both the therapists and the patients, we'll be rolling it out to other ambulatory sites. And the second project is the CHART grant, which is a very large state grant given to us to radically improve how we care for behavioral health patients in emergency rooms. So it's twofold. Both making sure that the emergency room care is better, because it's a terrible place for patients and our clients with behavioral health and substance use issues to get their care. So we want to make it better in the emergency room, and we want to have wraparound services for all of the clients and communities that we serve so that our folks don't end up in the emergency room to begin with. So this will involve all of our divisions over time, starting first with the emergency services folks. So stay tuned on that one as well.
So thank you very much to all of our staff. A special thank you to all of our direct care providers, including Dr. Sullivan, who sees patients at Heart House. Thank you very much for your service.
Thank you.